in every 1,000 births, about 82 women died during child delivery. And also, in every in neonatal deaths, about 55 children died during child delivery. So it's a bad thing as it is for a country, and it's not a good record that we rank the second after India in maternal neonatal mortality rates all over the world.
The population of women in their childbearing age in the country suffer health issues surrounding birth. While the country represents 2.4% of the world's population, it currently contributes 10% of global deaths for pregnant mothers.
Nigeria is one of the leading countries that have the highest number of maternal mortality rates.
The World Health Organization estimates the maternal mortality ratio to be over 800 maternal deaths per 100,000 live births. What factors are then responsible?
In Nigeria, we have this issue of poor access to quality health services, and especially, in the rural areas. Our women in the rural areas have this issue of accessing good, health care, especially, the pregnant women. We have both bad road infrastructure in Nigeria. So there are even those who are not living too far from the capital of their local government or their state. But you discover that when an emergency occurs, before a woman is taken to the city, we already have a complication. And then truly government need to do more on this. You need to encourage the midwives. Even the few who are in the local government need to be encouraged so that others too will see them doing well and they will be encouraged to take up employment in the rural area.
Professionally, there are causes medically that can attribute to these maternal mortality rates, like eclampsia, what we call eclampsia, pre-eclampsia, anemia in pregnancy, postpartum hemorrhage, placenta previa, and the rest of others. But however, there are also some people, women, who seek for non-professional care outside a licensed and certified health professionals like the midwife, the doctor, and the doctors and other nurses. This can also attribute to these mortality rates. You see people who are in white uniform, even a chemist, those who sell drugs, they call themselves nurse. Those who you see have a situation where doctors at own hospital gather some group of people, train them and call them nurses. They are not nurses. We don't have anything called auxiliary nurses in our curriculum. If you're not a nurse, you're not a nurse. If you're not a nurse, you're a quack.
Also, regulating the health space is important to prevent quackery.
The regulatory body in charge of who licenses nurses to practice in Nigeria are Nursing and Midwifery Council of Nigeria. Our own, the association, the National Association of Nigerian Nurses and Midwives, we also, in partner with Nursing Council of Nigeria, we regulate the profession. Like in each state, we have what they call Nursing and Midwifery Committee. That Nursing and Midwifery Committee, the state chairman of NAM and secretary is automatic member. The director of nursing services of a state is the chairman of that committee. They are the ones saddled with the responsibility to check this quackery in the state.
The National Reproductive Health Policy approved in 2010 by the federal government aims at ensuring availability and access to full sexual and reproductive health information and quality services. Yet, the death rate is on the rise, with children dying from malnutrition.
Every child born should be immunized against this childhood disease. That's what we call immunization. It is expected that every mother should give a child what we call exclusive breastfeeding, at least for the space of 6 months to 1 year, if possible. So that will help to increase the child immunity and also to prevent the early childhood disease.
Enlightenment is required in rural areas as religious beliefs, vaccine apathy, and accessibility remains major contributory factors to maternal births and child development. The government and traditional leaders need to do more on reproductive health in Nigeria. Olije Wapera, Arise News.
All right, thanks very much, Olije. Emmanuel Ajah is the country director, MSI Nigeria Reproductive Choices. He joins me now in the studio to look at this issue. Very warm welcome to News Night. That picture is so grim, you know, when you look at the World Bank data, World Health Organization data, you know, on Nigeria, we're only third in Africa, 1,047 per 100,000 maternal mortality. What is wrong?
Thank you very much, Christian. It's really a very worrisome data and the indices that we are seeing. A lot of things are wrong. If we start with the level of poor contraceptive uptake that we see in the country, across the country, with just limited number of persons who are able to access family planning. Of all that has been analyzed by your reporter, you see that we are talking about maternal mortality, and the only way and best way to address that is family planning.
And the family planning issue, I mean, it's been on for decades in Nigeria. We know there are socio-cultural and religious restrictions and the rest, and that's why the figure still says that northern Nigeria has the highest maternal and even child mortality ratio in the country. In fact, the state of Kebbi is the worst hit and the rest. How are you taking this campaign to the people?
So we have made some significant progress working with other partners, not just my organization, MSI Nigeria, but then working with other partners and the Federal Ministry of Health as well as the state government to get a lot of our women reoriented. And then it has started with the engagement of traditional institutions, the engagement of religious leaders, and expansion of access because
to health,
especially as it affects family planning. So before now, we had limited number of nurses and midwives trained across our health facilities. If you recall, in the north that you have mentioned, we knew that, which is still here now, that there is limited human resource for health, and that is why the tax shifting and tax sharing policy became very necessary for us, given that in the states that you have mentioned, we do not have the number of nurses, midwives, and doctors that we require to be able to provide services. We had to transfer to the CHUs that we have there, and it has been very successful. We've been able to train quite a large number of them who are now able to provide services in the northern states, not equally ignoring what happens within the southern part of the country.
Okay, that's some good development, but how much is this really panning out to reduce maternal and child mortality in Nigeria? Is it helping? Because I know funding is one major issue, and the federal government is not being able to meet its own commitments to where donors meet theirs. I'm sure partly the Minister of Health is watching this and...
Okay, so yeah, you are very correct. Nigeria made a commitment of providing $4 million annually for family planning commodities.
At the PHC level?
Yeah, I mean,
across.
Both PHC across.
Okay.
However, and then of course that is supposed to go into the basket fund, which is managed by UNFPA. To be very frank with you, that stopped sometime in 2018, the last release that we got. However, I think we have some hope. Professor Pate, who is the new minister of coordinating minister for health and social welfare, has taken the bulls by the horns by ensuring that we have that money back.
And the arrears, I hope he is going to get the arrears. He should get the arrears from the government.
I think, Christian, let's first ensure that the one that has been committed in 2024 budget, let's...
hope that it is released.
It's released.
It's in dollars, though, Emma?
Yeah, of course it comes.
It's in dollars.
Yes. So once it is released, the next will be what we do with arrears. Or how do we actually ensure that we increase that going forward. I think that is where we are. I think the first and foremost is the minister and the government making that commitment, not just verbally like we've had, but then getting it into the budget and the Senate having same approved. Just to equally mention to you that we saw that ray of hope when at the National Council of Health meeting that held in Ekiti late last year, there was a commitment from government making a call to both state and federal government to ensure that reproductive health, family planning is well budgeted for. So let's see how we'll go, and then we will continue to equally get some support from our partners. Yeah,
the year is only just beginning, and we hope that things will be accelerated in that sector. But let's just quickly look at two major causes of reproductive health in Nigeria. It's been attributed to heart diseases and stroke in women. Is that's rampant, really?
Two major causes of...
the reproductive health problems in the country that leads to maternal mortality is attributed to heart disease and
No, it's just majorly, I mean, everything that has to do with maternal mortality is as a result of pregnancy. Yeah, so if, and that's why family planning comes really very handy once you're able to provide that cover for the woman, including the heart disease that might come up, because there will be some complication if a woman is already pregnant and that woman is already having some complications in the heart. So how that is managed might become a little bit further complicated.
Well, let me thank you at this juncture. That's continued the good work and the advocacy, and then list a lot of the traditional people to disseminate the information more and better. Emmanuel Ajah, Country Director, MSI Nigeria. Thanks for coming on Newsnight.
Thank you very much for having me.